Recording.
Hello, I'm Dr. Adams, and I am passionate about orthodontics. So at the end of this presentation, if I haven't stimulated your interest, your fascination, and produced enthusiasm and passion in you for orthodontics, then I basically have failed. I hope I can do that for you. Okay, today's topic, fixed orthodontic treatment mechanics for the general dentist. Unraveling the malocclusion in stages, a holistic approach. So let's see what we mean by that. The effective treatment of one stage is a prerequisite for the successful completion of the next phase. That is the MBT treatment philosophy. So I'm going to explain how we achieve that in this program. So if you look at my 12 programs, and this unfortunately is just the fixed orthodontic treatment mechanics program, the holistic approach will be touching on other programs surrounding the patient in order to promote holistic health. Okay, so let's look at this program. We start off with the orthodontic foundation knowledge so that you become super aware of how genetics and the environment, epigenetics, has an influence on growth and development. Remember, you can never blame teeth. Everyone gets 32 teeth. So whenever you see malocclusion, space shortage, space excess, it's got nothing to do with the teeth. It's got to do with the underdeveloped arch form. Okay, arch form not big enough, not developed enough, teeth can't fit. So this is the message we're going to get across to you there. Then we follow through with diagnosis and treatment planning, which is very important because the most critical factor in any kind of medical services is that the treatment plan lies in the diagnosis. So if you can't diagnose a case, don't treat it. That means you don't have the treatment plan. So that's very critical. So we spend some time on that. In fact, I have a couple of, on my landing page, you should see 3 cases we've discussed so that to introduce you to that concept of understanding that the treatment plan lies in the diagnosis. Then we go to orthodontic administration documents, which I feel are critical because this is your medical legal requirement, and you have a contract of over 2 years with some patients or less than that. However, it's still a contract, it's a payment plan, and you need to make sure you get your documentation in order. And of course, brackets. Ladies and gentlemen, you might be using the MBT prescription, but you write the prescription for certain types of malocclusion, certain arch forms. So be aware of that. Then, of course, arch form development is critical. I just mentioned when I said that underdeveloped arch forms create a lack of space for teeth. So when a permanent teeth arrive, they can't fit in and you end up with space shortage. Overdeveloped arch forms can also result in space excess. So arch form is everything. Okay. And then number 6, anchorage control measures. You don't touch a tooth until you know what are the anchorage needs of that case. Are the anchorage needs mild? Is it moderate? Is it severe? Or is it maximum anchorage control measures? Or is it absolute anchorage control measures? And each of those dictate the type of treatment mechanics you'll apply to that case. So it's very critical, and we teach you that. Level alignment while you're trying to control your overbite. And of course, you need to reduce it. You need to get your overbite back to 2 to 3 millimeters. You need to then do overjet reduction once you have level and alignment and overbite under control. And then only when you got the overjet under control, can you do space closure. And then finishing, very critical in order to interdigitate the teeth so that Andrew's 6 keys of occlusions are applicable for this particular case. So you can end up with a case that's functional, that is stable, that is aesthetically pleasing. And of course, retention. The type of retention is very critical depending on how the malocclusion originated and how it presented to you. Right, so in this slide is the program that I'm going to be presenting to you. It's called the Fixed Appliance Therapy for the General Dentist in the MBT Treatment Philosophy. M for McLaughlin, B for Bennett, and T for Traversi. And this treatment philosophy is for mild to moderate skeletal class 1 cases. Got that? Great. So why have I chosen this system for you? Because it's the most widely used prescription in the whole world today. The prescription has stood the test of time and it remains unchanged. It has become the acceptable ideal for the human dentition. So I've chosen the best for you, and I hope you will come to learn to appreciate that later. So what do I mean by a holistic approach to contribute positively to overall health? Now, I want you, even though the cause is based on tooth movement, that's what fixed orthodontics is about. Okay, it's not just tooth movement, of course. Some of the forces are orthodontic, that is tooth movement. Some of our forces are orthopedic, so that stimulates the basal bone and the cortical plates as well. So you don't misunderstand me. But what I'm trying to say in holistic is that, please, ladies and gentlemen, we're going to teach you, let's get back there, to manage the causes of the problem and treat the symptoms. But it's the cause that comes first. That's what's critical for you to remember. So in that approach, we'd like to bring your attention to the fact that it all starts from the time the patient walks in. When you collect his name, you get his date of birth. That tells you where the growth is. The gender tells you where the female is, where the male is, where the growth spurts are. Okay, referred by tells you about your marketing. Okay, and please, you need to master marketing because that's where you want more of those patients. Okay, and of course, the person who examines the patient, the main concern is critical because you must make sure you deliver on it. Okay, patients have their own requirement, but of course, you have your own standards. You've got to deliver according to your standards. Patient's previous orthodontic treatment, the family history, the dental history, the medical history, orthodontic history. So all those factors are important for you to take or to determine where the case came in and how complex it is. And of course, very critical. At the end of the day, the dentist chooses the case according to his skill level. So please, you choose the case. I introduced this presentation to you and I told you it's for skeletal class 1 mild to moderate cases. So if the patient doesn't fit in that, don't choose him. So you're looking at his maturity, his intelligence, is the patient compliant, is he responsible, can he take instructions, can he follow up on those instructions? So you choose your patient carefully. And then once you've done that, in the back of your mind, you have 5 categories you've got to start filling in information on. So you will start putting things under problem lists, and then you need to work all those problems as a group to work out your diagnosis and then find solutions for each one of those problems. And of course, select the most effective and efficient appliance to treat that problem. And of course, work out the sequence to bring about the most productive finishing for the patient over the duration of treatment time. All right, so to repeat, we teach you to treat the cause and the symptom. Don't forget that. Of course, the cause is treated first. And you want to get the cause under control before you start to manage the symptoms. And lots of cases, we can do them as a combination, we do them together, as long as your patient appreciates the fact that the cause has to be fully under control for the treatment mechanics to be efficient. Right, so let's look at a few causes. Firstly, if your patient cannot breathe through his nose and postures incorrectly, you've got a major problem. That tongue that is responsible to maintain neutral zone has to leave its responsibility and move away from the palate in order for the patient to use his mouth as a nose. And when he does that, chaos ensues. And you can see that from the picture on the screen. So please, when you have a patient who has problems with breathing, you need to work with a multidisciplinary team, an interdisciplinary team, with the medical practitioners, the physicians, the allergists, the ENTs, the chiropractors. You need to work with a whole team to make sure you can maintain a patent airway, because trying to put brackets and straighten teeth in a patient with this problem is, I personally feel, it's negligence. You will not be able to maintain the stability of the case. So please be careful of that. So the next slide is going to be summarizing all that. We're going to look at how does the tongue contribute to causing malocclusions, incorrect swallowing, lips and cheek behavior, habits, incorrect diet, chewing, TMD problems, temporomandibular disorders. So all these factors have to be considered before you put brackets in the mouth. Allergic rhinitis, where a patient is unable to use his nose at night, have to manage with a multidisciplinary team to get this patient to normal nasal breathing before orthodontics can help. And sometimes in these cases, the orthodontist will put an expansion appliance to expand the upper maxillary arch, hence expand the floor of the nose, and that contributes to improving breathing. So the expansion is needed for the ENT to do his job. So be aware of that. So the picture next to this patient is an iceberg, and your malocclusion sits on the top out there, the piece that you can see above the water. But if you look below the water, you can see all the contributing factors that contributed to this problem. So hence, trying to solve the problem, the malocclusion with brackets and wires, is not the best solution for this particular patient. So be aware of that. And these are chronic cases that have been mouth breathing for extensively for years, and it has affected their face, and these are adenoid faces. So just be aware of that. And even in this case, you first got to fix the problem, the cause, before you go and align the teeth. Occlusal interferences, anterior crossbites, posterior crossbites, premature contacts. Please need to address those before you start putting brackets and trying to just straighten teeth out. Incorrect swallowing, major influence on growth and development. Soft diet, tongue thrusting, tongue ties can contribute negatively to growth and development. Reverse swallow, low tongue posture, all these things can contribute. And of course, an active mentalis in an adult, Botox it. In a kid, you got problems, you can't use Botox. So education is a major factor out there. Even in adults, you educate first. Active buccinator muscle can contribute to constricting arch forms. So if you look at all this, chewing, making sure patients chew a fibrous diet, TMJ problems, make sure there's no clicking, there's no popping, there's no pain and discomfort and headaches for these patients before you go and try and straighten teeth out. So this is where we make you super aware of the causes of malocclusion. And ladies and gentlemen, be aware that snoring is not normal. Okay, noisy breathing is not normal. Restless sleep is not normal. Daytime sleepiness, concentration issues, ADHD, bruxism, and large adenoids and tonsils. All these have to be addressed first before orthodontics or together with orthodontics. Allergies, asthma, frequent throat infections, sinuses, hay fever issues, all these factors have to be addressed by making sure you have a finger on the cause before you work on the symptoms. Right, so I think we've said enough for that. So now you're aware that you are responsible. It's your responsibility to take care of the causes and improve the overall health of the child. So that's where the term holistic treatment comes in. We work with other professionals in order to bring about a stability in the child's health, and hence ability to breathe and to function correctly. And then we now, as orthodontists, try and put brackets and wires and develop the arch form and align everything. So this is where we are. We're looking at the symptoms. So fixed braces address the symptoms. So We look at the dental arch form, we look and see the space shortage, space excess, and of course we need to work out a solution and diagnosis to treat that. We look at the arch form. Is it narrow? Does it have to be developed? Is it flattened? Is it hourglass? And then we work out orthodontic solutions for that. We look at the occlusion. We look at the molar and canine relationship, the overbite, the overjet. We look at any type of cross bites in front and the back, midline discrepancies, all that under occlusion. And of course, our treatment mechanics will have to solve that. And lastly, the facial development. Ladies and gentlemen, the mechanics are affected or influenced, are affected by the facial type. So a square face, a long face, a round face, all have different treatment mechanics. Patients on excessive medication and steroids have a deficient development of the maxilla, and of course, its width transversely and the floor of the nose. So be aware of that. Skeletal class 2 and 3 are referred to an orthodontist, so and watch for gummy smiles. Okay, so those are kind of things you're looking at to identify so that you can refer appropriately. Right, how do we go about making that diagnosis? We take records. You need to make sure you got your photos, your models, your radiographs, your pan, your ceph, and you need to draw these things so that you can direct your treatment plan. And cephalometrics are very critical to help you to understand whether you're treating with growth or against growth. What are you fighting against? And then you know whether your treatment's easy or complex. Now, all this information that you've gathered, we teach you to put it into a problem list, and we have provided you on our landing page with 3 cases where you can see how we look for the treatment plan. It lies in the diagnosis. So we make a problem list. So from that, we can make a diagnosis. And in the diagnosis, we try and solve each of the problem. And that brings about, exposes the treatment plan to you. And hence from there, you can select the appliance. On the picture on the screen, these are arch wires for fixed orthodontics. However, ladies and gentlemen, there's preventative orthodontics, there's interceptive orthodontics, there's myofunctional orthodontics, there's growth modification, and then there's corrective orthodontics. All right, so you can see from that, and of course there's surgical orthodontics and et cetera, So you've got to then choose your appliances. Remember, our treatment is limited to skeletal class 1 mild to moderate, so I'm not going to go too extensively on all the other different appliances. Then we choose a sequence. How do we unravel this problem this particular patient has? We look at our anchorage control. We look at and we follow a sequence where we level, align, control overbite, overjet, space closure, finishing, and retention, like I explained earlier. Okay. Now, when it comes to anchorage control measures, this is very critical. Some patients' anchorage control needs are mild, some are moderate, some need maximum anchorage control measures, and some need absolute anchorage control measures. I need to know that before I put an arch wire into the bracket slot. And this is where you master the skill of understanding that. Okay, so anchorage control measures, you've got to master the skill to work out what the anchorage control needs are for each case. And we will teach you that. And of course, you've got to know how you're going to finish your case. Are you finish your case with class 1 molars, class 1 canines, overjet and overbite of 2 to 3 millimeters, competent lips, low facial height and mandibular plane. So all these are the sequence in which you're going to unravel your case and treat it in order to achieve the outcome, the finishing. Great. And of course, how do you do that if you can't answer the following questions? Do you know what preventive orthodontics can do for your patient? Do you know what interceptive orthodontics can do for your patient? Do you know what growth modification can do for your patient? Do you know what myofunctional orthodontics can do for your patient? And of course, growth modification is there. And do you know what fixed orthodontics can do for your patient? And once you are educated and made aware of that, it makes the quality of the treatment mechanics you offer your patient more efficient, more effective, and more productive. It helps you determine, can I treat this patient in 1 phase, or 2 phases, or 3 phases? So do I treat 1 phase, wait, and do this 3rd phase? do I just go from phase 1 to phase 2? So this is what it does for you and your patient. Right. So in finishing, I have a question for you. Are you interested now? Have I stimulated your interest, your fascination? Are you enthusiastic to find out more? If the answer is yes, then send an email with the word interested, and then I will email you the following: the detailed breakdown of each program, the 12 programs, so at least you can see exactly what you're going to be covering in these topics. The flyer, it's a summary, it's a promotional flyer that tells you the needs, the treatment philosophy, and of course gives you my details, my CV, and of course, and how to recover the cost of this program. The registration form, and of course, testimonials I'll be sending over to you. Great. And of course, the next question, are you not sure? Then all we need is for you to also send an email with the word free Zoom session, and then I will contact you with the date and time for a live recording, because there you can ask questions. Okay, if you miss that and you book for the next live recording, it's fine. If you feel, nope, you need a copy of the recording, I can send that to you. I'd like to thank you for your valuable time, and I look forward to hearing from you. All the best. Bye-bye.